nimefika, naona tu kifo mbele yangu. Kama mheshimiwa na kuna pesa, amekufa juu ya hii ugonjwa. Sasa mimi nateseka hivi.
Mimi hata nilikuwa sina usingizi. Na si ati sina usingizi ati kwa sababu nastukia ati niko na kansa. Vile niliambiwa niko nayo, hata usingizi tu ilijipoteza tu yenyewe.
Now, those are just a few voices of the cancer warriors that we spoke to throughout the past week. Cancer is a diagnosis that is life-changing because it affects every aspect of our lives, financially, mentally, socially, and so much more. And it's not just the patients, their relatives, their friends, all the people who support them through this journey will have a story to tell regarding this diagnosis. Today, we are looking at cervical cancer. Globally, cervical cancer is the second most common cancer in women, with over 660,000 new cases being diagnosed in a year. Out of these cases, we're actually looking at mortalities of up to 350,000 as per the Global Cancer Statistics of 2022. Now, Kenya has a population of about 16.8 million women aged over 15 years, and these are the women who are actually at risk of developing cervical cancer. Cervical cancer in Kenya is the second most common cancer that leads to cancer-related deaths among women, according to Global Cancer Statistics of 2020. Now, when we look at Kenya alone, in a year, we have over 50,000 new cases every year, and the mortality rate is actually above 3,000. Kenya has one of the highest rates of incidence globally, with about 40.1 new cases of cervical cancer per 100,000 women every year. In the general population, about 9.1% of women are actually testing positive for the human papilloma virus, and this is for the high-risk strains, that is 16 and 18 at any given time. About 63.1% of the invasive cervical cancers that we find are actually attributed to HPV 16 or 18. Now, to bring this home, when we talk about 350,000 cases being diagnosed, deaths every year, this actually means that every 2 minutes, somewhere on the planet, a woman is dying of cervical cancer. Now, that is one woman too many for a cancer that is treatable and a cancer that is preventable. And that is why this is the first cancer that we're discussing here on ULIZA Daktari. Good evening, and thank you so much for joining us on ULIZA Daktari this blessed Sunday. Indeed, happy Easter to all of you. He is risen, and by his stripes we are saved and we are blessed. My name is Dr. Lauren Mengerson, and I am your host. Now, our very, very sincere gratitude and thanks to CIC Group, who is our sponsor on our show today. This group is dedicated and reminding us every time to care for those that we love and what we love. CIC offers a variety of medical covers. CIC Family Medisure for comprehensive family health. This includes your inpatient, your outpatient, maternity, dental, optical, and last expense cover. CIC for seniors, which covers both chronic conditions and management, and this also includes home nursing. And if you belong to a chama, a cooperative, or a SACCO, we also have a cover for this microfinance that will benefit the members of your group. Now, on the show today, I'm very honored to have two very special doctors when it comes to the cervical cancer space. I have with me Dr. Masinde, who is a gyne-oncologist. And we have Dr. Maranga, who is also a gyne-oncologist. Now, Dr. Millicent Masinde is an obstetrician and gynecologist. Na tukisema gynecologist, ili mweze tu kuelewa, inamaanisha kwanza, these two doctors went to school and became doctors. Halafu they went back and became obstetricians and gynecologists. Baadaye they do a fellowship just to narrow down to specialize just in cancers in gynecology, and that is when they become gynecologists. So Dr. Masinde is an alumni of the University of Nairobi. She is also a consultant practicing at the Kenyatta National Hospital, and she is very passionate about cancers and started from her early career into research on matters related to cervical cancer. When she's not doing this, Dr. Masinde, you'll find her busy cooking, and she loves to travel, and a good road trip is how she loves to unwind. Karibu sana, Dr. Masinde, to the show. We are honored to have you here with us.
Thank you so much.
Dr. Maranga Aurora is a gynecologist, and he's actually a double doctor. Not only is he a specialist in obstetrics and gyne, but he has actually gone further to pursue a PhD in matters to do with cervical cancer. Now, Dr. Maranga is a consultant both at Kenyatta National Hospital, where he participates in training doctors just like me and many others to handle matters to do with all cancers that are in the gynecological space. And he also practices at Janice Hospital. In both spaces, they're able to provide affordable and accessible care for women who are diagnosed with cervical cancer. When he is not working on cancer patients, you will find Dr. Maranga on the golf course, and we'll soon find out. We'll ask him whether he has a handicap and what it is very soon. Karibu sana, Dr. Maranga, to the show.
Thank you, Daktari. Thank you.
Now, just to understand a bit more, on this episode, we're going to be listening to some of our cancer warriors, and we want to hear the stories, what they've gone through, just finding out that they have cervical cancer, how the treatment journey has been. And to start us off, we are going to have our first guest, Mary. Let's listen to her story.
Nilipatwa na cervical cancer. Na kabla ijulikane nilikuwa na cervical cancer, nilikuwa na magonjwa mingi before, ambayo ilinipeleka kitu kama miaka 3 kabla cancer haijapatikana. Nilikuwa na skin complexion yangu ilichange. Sasa nikashindwa hii skin yangu ni nini? Kumbe ni ugonjwa nilianza kukua nayo. After that, nikaanza kuumwa na miguu. Nikafikiri pengine ni kazi yenye nilikuwa nafanya ndio imefanya mguu iume. Nikaambiwa kuna viatu vingine sijui inasol, hizo nilinunua. Nikaambiwa hiyo mguu naweza dungiwa shindano, nikadungwa. Kutoka kwa hiyo mguu nikaanza kuumwa na mgongo. Sasa hiyo mgongo ilikuwa very serious. Hata nikitoka kazi lazima nipeleke kwa nyumba na pikipiki. Aya, kitu ikaanza kunifura kwa tumbo hapa hivi. Ukishika hivi unasikia. Nikaambiwa niende niangaliwe kwa ultrasound. Nikaambiwa niko na fibroids 3. Moja ni 6.7. So nilikuwa supposed kufanyiwa operation. Daktari mwingine akaniambia usifanyiwe operation, kuna madawa unaweza tumia na fibroid yeyuke tu. Sasa nikaanza kutumia hizo madawa. So unajua ni dose, lazima uzitumie polepole, uone kama pia unapona. So hizo madawa vile nilianza kuzitumia uchungu ikaanza kukua mingi. Nilikuwa na harufu mbaya. Na hizo discharge zilikuja ikanifura kwa uterus, mpaka uterus ilipanda mpaka huku juu. So zilikuwa zinatoka tu, ukinifinya hapa hivi, zinatoka tu kama usaha. Nikatembea sana, nikitafuta matibabu. Nilikuwa to blank. Juu nilikuwa nasema kansa inakuanga ya uko. Mimi nikue kansa namna gani? Nikasema hii ni fibroids. Nilienda kuangalia hiyo maneno hata after kupata hizi results. Bado nilipelekea madaktari wenye nilikuwa najua wanisomee kama hiyo kitu ni ukweli. Mpaka siku yenye nilianza matibabu ndio nikasema kumbe hii kitu ilikuwa ni kansa.
Now, Dr. Maranga, Mary is talking about cancer kuwa kitu ya ukoo. When it comes to cervical cancer, is this something you think is common?
Cervical cancer is very, very common, indeed, just like you have said in your presentation. But it's not hereditary. It's mainly caused by human papillomavirus, a virus which is sexually transmitted. It's extremely, extremely common. It's the commonest type of organism which is sexually transmitted worldwide. And it's so common. If I give you an example, if you take a cohort of people, you follow them up to the age of 60. By the time they reach 60 years, 90% of them would have had a brush with the human papillomavirus. But only 5% would actually have that persistent human papillomavirus infection, which now would generally lead to the changes which, if they're not treatable, or if they're not treated, then can lead to cervical cancer. So to answer your question, it's not hereditary as such, but there are factors, of course, which make one more susceptible to cancers in certain ways, but you cannot say cervical cancer is genetic, no.
Sawa sawa. So sio mambo tu ya ukoo. We are talking about an infection, tunazungumzia mambo ya HPV. Na kabla tuingie swala hilo, tunataka kusikia kutoka kwa Beatrice ambaye pia ni mmoja wa survivors wa saratani ya shingo ya kizazi.
Nafanya job ya hoteli. Sasa nasikia mgongo. Sasa nikisikia mgongo nikikaa ni damu. So ikafika siku, sengine naenda shift ya usiku, sengine naenda mchana. Hiyo siku ilikuwa mchana. Nimelala sasa mchana. Sasa nimestuka tu kitanda ni baridi. So nikiamka nikiangalia nikapata damu. Sasa hiyo unajua mimi ni single mother, mzee wangu alikupanga. So kuna jirani yangu nikampigia simu. Alikuwa mimi niko first, yeye alikuwa third. Anaitwa Mama Tamara. Nikamwambia Mama Tamara uko wapi? Ati niko kwa nyumba. Hebu kuja kwa nyumba. So vile alikuja akanipata akasema hii hapana. Nikasema nipeleke. Na uwezi jua niko mgonjwa. Niko tu mwili ilikuwa tu sawa. Sasa kuna vile wananipima, waangalie hii damu inatoka wapi. Walishindwa. Sasa wakaniandikia hiyo letter ya transfer, nikaenda Kenyatta. Wakati hiyo process, nimefanya process after 1 month. Wajua ugonjwa haisimami, inaanza kunini tu. Mpaka ikafika stage 3B. Nisema niko na kansa aje. Naona tu kifo mbele yangu. Kama mheshimiwa na kuna pesa amekufa juu ya hii ugonjwa. Sasa mimi nateseka hivi. Nitafanya aje? Hiyo kitu iliniuma. Niuliza daktari, niko na kansa aje na damu inatoka. Sina juanga wenye wako na kansa inakuanga na kidonda, na mimi sina kidonda, ni damu inatoka. Hiyo swali niliuliza daktari. Na saa hiyo nilikuwa tu kiniona huwezi jua niko na hiyo ugonjwa. Niko tu sawa, niko strong, huwezi jua kila kitu. Ni hiyo damu tu ndio ilikuwa, hata maumivu vingine kwa ni hiyo damu na mgongo nilikuwa nasikia.
Now you can see the emotion there. You can see how desperate sometimes these situations make patients feel. Talk to us on our SMS line 22422. What do you know about cervical cancer? What has your experience been as a patient or someone supporting a loved one with cervical cancer? Our handles are active on ULIZA Dakatari Citizen and on Daktari Mengesa. Now, Dr. Masinde, when we make this diagnosis for patients, what is your experience on how they feel? What is the initial reaction you get when you tell a patient, you know, I'm sorry, but this is what we have found?
So the one thing we forget is that before a cancer diagnosis, life seems very normal. But the minute you say somebody has cancer, it means your plans cease to make sense. All the hopes and dreams begin to look very shattered. So when you're telling a woman they have a diagnosis of cancer, you have to remember that it affects their entire being, their family, their hopes, their aspirations, their dreams, the future of their children. And so at the point where you give the diagnosis, you can see that it's not just one thought that's going through their head, it's very many aspects of their lives. Yeah.
So indeed, life-changing it is, and it normally seems like from that moment, even that consultation, you almost want to just stop it there because of how much they have to process. Now, before we go further into this discussion, we just want to have a bit of a look at when we talk about cervix, what exactly do we mean? Tukiongelea cervix na kansa ya cervix, ni sehemu gani ya mwili ambayo tunazungumzia? So we have an image that we are looking at. So tukiangalia hapa tunaona picha ya kizazi cha kike. Now tukiangalia hapa unaweza ona kuna nyumba ile ambayo inaitwa nyumba ya mtoto. This is where we normally have when you're pregnant, this is where ideally the pregnancy would sit. Now ukiangalia pale unaona ile nyumba ya kizazi, it narrows down pale chini na kuna sehemu ambayo inaitwa cervix. So cervix kwa Kiswahili wengine wanasema ni shingo ya kizazi, wengine wanasema ni mlango ya kizazi. Hiyo ndio sehemu ambapo wakati mwanamke anajifungua pale mtoto anapitia. So when we are talking about cervical cancer, that is the part of the body that we are discussing. Pale kwa cervix, hii ni saratani ya hiyo sehemu. So just to understand, Dr. Maranga, you mentioned about HPV, human papilloma virus. Tafadhali tueleze a bit more about it. Ni nini, mtu anaipata vipi, and who is at risk of getting this HPV?
As you said, human papilloma virus is essentially what causes cervical cancer. It is sexually transmitted. And as we said, is the commonest sexually transmitted organism in human beings. And so many people, so long as one is sexually active, they basically have that risk of acquiring human papillomavirus. But there are those strains, those types, which are more vicious, the high-risk types, like the ones you mentioned, type 16 and type 18, which would be very vicious. They would be quite aggressive, and they would persist more. From your presentation, in the population we have like 9.1%.
About 9%, yes, of the general population.
But then they end up causing almost 70% of the actual cancers. So the other risk factors, there would generally be acquisition of factors which would lead to acquisition of a sexually transmitted infection. And that includes other sexually transmitted infections like gonorrhea, chlamydia, syphilis, and such types. Risks like multiple sexual partners or having a partner who has multiple partners. There are other factors, of course, like smoking, and then low immunities, situations which cause low immunities, like in HIV/AIDS. Those ones would not cause cancer per se, but they'll make the environment more likely for the HPV to persist and to cause problems in the body. So
tunasema shida hapa ni HPV, and not everybody who is getting HPV is getting cancer. Shida ni kwamba ukipata hii infection ya HPV na isiweze kutibiwa ama ibaki kwa muda mrefu, that is when hiyo HPV inabadilika na inaleta hali ya saratani. Now before we go into kujua Wakenya tulozungumza nao ni nini wanajua kuhusu kansa ya cervix na wanafikiria inatoka wapi ama inasababishwa na nini, we'll go on a very short break and then we'll be right back to get right back into this discussion.
Ile saratani ya kizazi kulingana na vile naelewa inakuja kupitia mambo ya ushirikiano wa bibi na bwana ama mwanamke na mwanaume.
Sana sana inakujanga na mambo ya kuzunguka sana. Kama ni mwanaume pia inakujanga na hiyo kuzunguka, kubadilisha wanawake kila wakati.
let's call a spade, not a big spoon. The vaginal part is very sensitive to dirt. And also if we mix or if we have multiple partners, we are at risk of getting this cervical cancer.
Wamama wanajificha sana. Wamama hawataki kuongea. Unapata mama kuna shida lakini hataki kuongea na ogopa.
Cervical cancer majorly affects the cervical areas of a woman, and in most cases, if not treated early, may cause lack of conceiving children.
Ni ugonjwa mbaya. Ndio sababu hata wameweka vituo ya kuipima. Sio lazima usikie kama mwili iko na problem ama nini. Inafaa unapima kwanza kila venye wametuambia.
Wengine najua wengine wanaogopa kwenda kupimwa. Sasa wanaongoja mpaka inaenda stage 4.
Ningependa kuambia the procedure is very simple. I've undergone the procedure. Very simple. Procedure inaitwa viability. So a very simple, they just collect the swab, then wanaipima hapo na hapo, then wanakueleza kama kuna chembe zozote za cervical cancer, na kama ziko, they'll advise accordingly kwenda kuanza matibabu.
Welcome back to ULIZA Daktari. I am your host, Dr. Lauren Mengesta, and today we are talking about cervical cancer. Now, tumesikia something zikisema hapa. Fabish anasema alisikia kwamba hii saratani inafanya huwezi kupata mimba. Hiyo ni kitu ambacho umesikia, Dr. Masinde, is that true? And what would you say are the common symptoms we would be looking for? Ni nini ukiona inaweza kuwa dalili ya kwamba unaweza kuwa na hii saratani?
So the first thing we need to remember is that before cervical cancer occurs, there are precancer lesions. And the progression from normal to cervical cancer takes a while, very many years in between. Now, the period where you have a precancerous lesion, there are no symptoms. And that's the period where we should be screening so that we get it early. By the time you start complaining of any symptom, you're most likely having the diagnosis of cancer of the cervix. We've heard what the survivors have actually talked about, and everything they've described is actually a symptom. So you have women who present with uterine bleeding, pervaginal bleeding, and many people don't think much about pervaginal bleeding. But the question I always ask people is, when it's not normal, you should ask yourself why. The why will lead you to find the reason as to why you have a problem. It can then progress on to having an abnormal discharge that is usually foul smelling and very characteristic of actually cancer of the cervix. Then once the cancer starts spreading, depending on where it has spread, then you'll present with other symptoms. Some people start complaining of maybe difficulty in passing urine, difficulty in passing stool. Sometimes you have a backache if it has gone to the back. Sometimes you can actually present with leg swelling as your first symptom, where now we have the blood vessels in the lower limbs have been blocked, and therefore now you present with a swelling of the legs because of that. So it's not a one size fits all. It depends on where it has spread to. But largely I think if women are just more keen on their vaginal health, they will be able to get that something is wrong at the very start. Now, can you get pregnant when you have cervical cancer? Yes, you can. But the projection of the pregnancy becomes very different, because you can easily, start bleeding. You still need to get treatment even when you're pregnant. So yes, it's possible to get pregnant, but it's good not to, so that you can be able to get treatment.
So I think it's very important to highlight this abnormal bleeding, because mara mingi unapata kwa clinic anakwambia na hii symptom imekuwa for a long time. A woman has been bleeding, and sana nakumbuka mki emphasize sana the issue of bleeding after intercourse. being a very characteristic feature of this kind of cancer. So ukiona bleeding yoyote ambayo si ya kawaida, tafadhali unahitaji kuona daktari. Now there is this common feeling and common thing. Every time I'm in the clinic, I tell a patient, when was your last pap smear? We need to do a pap smear. Anasema, daktari naogopa. Pap smear ni uchungu. Nimeambiwa kuna nyama itachukuliwa pale. So the question is, hii pap smear, Dr. Maranga, ni nini exactly? So that tuelimisha tuelewe. Tukisema tunafanya pap smear, tunachukua test ya aina gani? And ni wakati gani is it ideal kufanya hii test? When should a patient come in for this pap smear?
So pap smear ni vile umeelezea, ni kuangalia upande wa hiyo sehemu ya vile umeita shingo la kuingilia nyungu ya mtoto. So tunaangazia huko, kuna njia nyingi za kuangalia ukule. Kuna hii ambayo inaitwa vile ambayo umeisikiza, ambayo daktari anaangalia kule kwa cervix. Alafu kuna dawa ambayo anapaka kule, alafu kiangazia anaona mabadiliko gani ambayo yapo kule. Alafu anasema kama kuna shida ama hamna shida yote. Hiyo inaitwa vile, na mtu anaweza tibiwa papo hapo. Alafu kuna hiyo yenye tunaita pap smear ambayo tunatumia brush ambayo tunatoa cells kutoka upande wa kizazi hapo kwa cervix, inapelekwa laboratory, inaangaliwa under microscope. Alafu tunaambiwa kama cells zenyewe ziko sawa ama ziko na dalili yote ya kuleta cancer. Alafu siku hizi kuna pia ile ya kuangaza kama kuna HPV virus ambayo tumeongea, ambayo naangalia, sababu tumesema ya kwamba hii HPV virus ndio ambayo inasababisha kansa ya cervix. So kuna test ambayo siku hizi mtu anaangaliwa, mwanamke anaangaliwa, tunatoa cells kule kwa cervix, zinaangaliwa mambo ya DNA ya hii HPV. Alafu kama ipo ndio sasa mwanamke anachunguzwa zaidi ili kuona kama hii HPV kuna mabadiliko ambayo imesababisha ambayo yanaweza leta kansa. Lakini ikipatikana ya kwamba mwanamke hana hizo ama virusi vya HPV, basi wanaambiwa kwa sawa, alafu waweze kuangalia maybe baada ya miaka 3 ama hata miaka 5 baada ya hapo.
Naam, nasikia msiogope kufanya.
Niongeze, hamuna uchungu vile. Actually hakuna uchungu. There are many who actually fear coming to do the pap smears.
Exactly.
And many times is hearsay. They have heard it from somebody else. And when we do a bit of counseling and the client agrees to that, at the end of it they would generally be surprised that actually it wasn't painful as had been the case. Yep.
Now, pap smear is one of the most critical ways of screening for cervical cancer. Na tunaomba tafadhali msiogope kupimwa. Daktari amewaambia haina uchungu, ni kipimo cha haraka. Na wakati unakuja hii pap smear, ni vyema kuja wakati ambapo hauna ile damu, wakati hakuna hedhi. Kama kuna infection yoyote pia ni vizuri itibiwe mwanzo, alafu baadaye tunaweza tukafanya ile pap smear. Now, tafadhali please send in your questions. Our SMS lines are open on 22422. Our number is open, so you can call in with your calls. Engage us on our socials at ULIZA Daktari Citizen and at Daktari Mengesa. We will be responding to all your questions shortly. Naam, sasa Daktari Masinde, tumezungumzia mambo ya HPV, mambo ya risk factors. So nimesikia kama Mary akizungumza alifanya ultrasound ikasema ako na fibroids na tests zinginezo. Which are these tests that are normally done ili tuweze kufanya diagnosis tujue kama mtu ako na cancer?
So Mary amesema mambo ya maana sana. Vile mtu anapoenda hospitali, vile anakuja ndio watu wanaamua vile watamwangalia. Lakini the most important thing is when you present, we have to look at your cervix.
Yes.
And I know that's one of the things people don't want. But you look at the cervix so that you're able to decide, are we going to start with the screening bit because you have a precancerous lesion? Or are we going to take a biopsy? Tutatoa nyama ndio tuweze kujua kama ni cancer ama si cancer. ambapo tutapoamua ni cancer, tutaweza kufanya test zingine za radiology kama MRI. MRI itaweza kutuelezea hii cancer imeenea hadi kiasi gani. I think it was Mary or Beatrice who said it had gone to the back.
Yes.
So the MRI would be able to tell us how far has it spread, and therefore how much of the treatment can you be able to do. So we need an MRI, we need a biopsy of the cervix, we need a chest x-ray so that we're able to know, has it gone to the lungs? Because if it has gone to the lungs, then it means the treatment looks very different. And that means then also what the tests enable us to do is to give the stage.
Yes.
Because the stage determines your treatment plan. Yeah, so from what I heard from them, actually they both presented with pretty much later disease. And so their treatment was more on radiotherapy and chemotherapy and the like.
Dr. Maranga, Dr. Masinde has mentioned staging. Maybe unaweza tuguzia tu just briefly when we talk about stages. Mesikia Mary na Beatrice wakiongelea 1A, 1B, but maybe just in a very simple way. When we talk about staging kwa cancer ya cervix, what do we mean?
When you talk about staging of cervical cancer, there is stage 1 up to stage 4. Stage 1 is when the disease is confined to the cervix. So ugonjwa hujatoka hapo kwa cervix, iko tu papo hapo, haijaenea popote. Kisonga kidogo hivi, labda ishikilie upande wa njia ya kizazi, upande wa kule juu karibu na cervix, hiyo inakuwa ni stage 2. Kisonga tena kidogo iende kando kando, lakini iko bado hapo kwa cervix, iko hapo kwa pelvis, kwa tu karibu na hizo organs za kike, inakuwa kama stage 3. Ikifika tuseme iguze upande wa mfuko wa mkojo ama upande wa rectum, hiyo inakuwa ni stage 4A. Ikitoka kule chini iende kwingine, tuseme iende kwa maini ama iende kwa lungs, inakuwa ni ama popote kwingine, inakuwa ni stage 4B. Yeah. Na labda niongezea hapo ni kwamba matibabu huwa yanategemea na stage ya ugonjwa. Ikiwa ni stage 1 na ile tunaita stage 2A, hapo ndipo tunafanya operation. We do operation, we do an extensive surgery to remove the whole cervix, remove the uterus, the uterus of course. And lymph nodes. So it's an extensive type of surgery. And that one is usually for early stage disease, stage 1 up to stage 2A. But if it's beyond stage 2A, then we do off radiotherapy and chemotherapy. These are terminologies which tend to confuse people.
Yes, a lot.
Chemotherapy ni shindano. Wasikizaji wetu ama wale wanatuangalia. Ni shindano ambazo zinapeanwa kwa drip na zinaingia kwa damu. Hiyo ndio tunaita chemotherapy, chemicals basically, chemical drugs. Alafu kuna radiotherapy. Radiotherapy ni kuchomelewa, inatumia radiation energy. Na kuna upande wa cervix, kuna ile tunaita external radiation ambayo tunachomelewa kutoka upande wa nje, na kuna internal radiation ambayo pia inaitwa brachytherapy. Kwa wale wanatuangalia na wameenda through that wanatuelewa vizuri. So kuna aina mbili za kupeana hiyo radiotherapy. Naam.
Okay. So I think kile nasikiza pia kutoka kwa Dr. Maranga ni ile stage ikiwa ya mapema, then there are more options when it comes to treatment. As we move further into stage 3, stage 4, then the likelihood ya kutibu hii cancer hadi ishe inaenda ikipunguka zaidi. Now, thank you for that. A lot of things to think about, a lot to digest. We are going to take a short break, and please remember to SMS us on our lines 22422. This is your show. We need to hear your voice. We want to hear your questions. Wataalamu wenyu wako hapa. Tafadhali zungumza nasi. Now, you've had Dr. Maranga talking to us about all these treatment options, chemotherapy, radiotherapy. Hizi vitu zote lazima tutagaramika. CIC, our partner, is here to ensure that you're covered and you are safe. For you, your family, your cooperatives, they're here to remind us to protect who and what we love the most. Sasa, Dr. Masinde, there is this discussion on prevention. Tunasema hii cancer, it's a preventable cancer, it's a treatable cancer. Could you please talk to us about preventing saratani ya kizazi cha wanawake?
Now that you mention it, actually, prevention is has three facets. If you look at the WHO strategy for eliminating cervical cancer, there are three facets to it. The first one is primary prevention, where we are talking about the HPV vaccination. And you've heard about the 90-70-90.
90-90, yes.
So 90% of girls who are 15 years should have been vaccinated by the time they get to 15 years of age. And when we give HPV vaccine, it is estimated that more than 90% of the cancers will be eliminated. So that's a good, simple entry strategy for preventing cervical cancer. Then when we move to the 70%, which is the secondary prevention, that's where we aim to treat we aim to screen 70% of the women, at least by the first time they are 35 years of age, and at least a second time by the time they are 45 years of age. And the third one is 90% of the ones who actually present with any of our precancerous lesions or cancer of the cervix should access treatment. So that's how WHO has looked at it. Are we there yet? No. But through this show, we should be able to encourage women that it's not painful. The screening processes are easy. Vaccination should be encouraged because we want to have a population that's not getting cervical cancer. In Kenya right now, every day we are losing at least 9 women because of cervical cancer. Can we prevent it? Yes, we can. We should be able to take at least an option depending on what age we are and what prevention methods are accessible to us.
Okay, Dr. Maranga, just before we get into our questions, is this vaccine safe? This HPV vaccine, is it safe? And where can our listeners, where can they find it?
Yeah, the HPV vaccine is very safe. It has been used worldwide. It's now almost going to 20 years. And there are many patients who ask me when they bring their daughters, how safe is it? And my simple question usually is, I trust it. My 2 daughters have gone through it. And it's usually given 3 doses. One is given like day 0, like today. It's repeated after 1 month. And then it's repeated again at 6 months. Although there are studies which have now shown that even the first 2 vaccines, they're actually adequate. So it's very, very safe. It should be given generally between the age of 9 and 14 or 15. I'm sure the parents watching us, you may have gotten a note from the school.
Yes.
Yeah, giving permission for the vaccine to be given. But ideally, any young lady, any woman can get and can benefit from it. So long as it's proven that you don't have the HPV virus or you don't have any cancer.
Okay, now on to our questions coming in on SMS and our socials. Pendo Neema anauliza, Dr. Mengesa, I'm kindly asking, is a watery discharge that sometimes has a foul smell and other times no smell, and also she's talking about itching around the vaginal area. Is this a sign of cervical cancer, Dr. Masinde?
Yes and no. So one of the early signs and symptoms of cancer of the cervix is upper vaginal discharge. But disclaimer is, not every discharge is cancer of the cervix. And maybe that's why we are saying anything that's happening to your vagina that looks out of the ordinary should be assessed. Better late than never. We'd rather find it early as opposed to waiting until we are having abnormal bleeding, postcoital bleeding, and the like. Essential to note that even vaginal infections present with discharge. So it's good for her to have a pelvic exam so that you can be able to know what is the cause.
Okay, so time is not on our side. Thank you so much, Dr. Masinde, for joining us. Thank you, Dr. Maranga, for honoring us with your presence. Now, please remember, we need to do our pap smears. We need to get checked, and we also need to plan because we don't know who is going to get this disease. And to do this, please make sure you're covered. CIC Insurance has a lot of options where you can be able to be prepared and be ready for any eventuality, should it be this or any other medical condition. Now, please continue engaging us on our socials. We'll continue responding to your questions even after the show. Keep talking to us, keep engaging us. Thank you for joining us this week. A very happy and blessed Easter to you. Happy birthday to Ibrahim, our director, and see you again next week, same time, 8 p.m. on Sunday at ULIZA Dakatari.
Up to now, mimi naona tu na wenye wako nayo wakae tu na nguvu, wakae na imani. Hata kama naenda na chomwa, ajue atakufa, atapona.
Leo tunaongea na Kiswahili, wenye wataisikia na Kizungu. Wakae chini, waangalie hizi vipindi. Si waangalie tu kama movie tu vile tunaona hii ya watoto haitusaidi. Angalia kuona ugonjwa yenye uko nayo. Daktari huyu anasema nini kuhusu ugonjwa.